Our politicians like to call for universally available care. And let's just take a moment to imagine what that could actually look like. If you're a parent, you wouldn't have to face this tough choice of keeping your job and finding a place for your child to have a high quality learning experience. If you're an early educator, you don't have to face the choice between a career that drives you and a passion that you have for that work and one where you can afford to retire at the end of your career. It would also look like our ecosystems prioritizing children. And I don't just mean our local county offices of education or social services. What I mean is that when developers are creating proposals for new buildings, they know to prioritize building facilities for childcare. When our economic development agencies and workforce development boards think about the future, they know that childcare is an essential piece of what they do too. The result of that is that families have what they need, workers are cared for, and society as a whole is more child-friendly. California is very concerned about the long-term viability of its policies for families. They're worried that people can't afford to stay or are foregoing having children that they would want to have. And it's pretty clear. Everyone understands that childcare is needed to get us there. We have decades of research and consensus building on the importance of early care and education. In many ways, it's one of the policy areas that has the furthest to go to be realized as a public good. There are plenty of ways to make the case for abundance in early care and education. There's the child development argument that we're creating the environment for healthy growth and learning for children. There's the economic case, which is particularly important to audiences right now, that shows that parents can go to work and also children can grow up and be productive members of the workforce. But ultimately, it's pretty clear to anyone with a child or who has a friend with a child that childcare is an essential. But what we're talking about here is building the supply of licensed childcare spaces, mostly in childcare centers and family childcare homes. When we're in the system, we only have room for about 1 in 4 children in California to get the care that they need. We know that a single parent with a young child could spend nearly half her salary for an infant in a childcare center. And that's what happens when parents are absorbing the cost of this unaffordable system. Instead, we're operating in a state of market failure. The parents truly can't afford the options that are available to them. And also at the same time, the workers can't afford to keep those jobs. We have a perpetual state of turnover among educators. And often these are among people who are getting started in the field and they realize it's just going to be too hard to make a living. States like California and even localities within California are making headway in embracing early care and education abundance. But on the whole, we are actually not the leading edge as a state. Instead, we should look to New Mexico, which last fall became the first state to offer universal childcare for families at all income levels. Now, their state is pretty different from ours. They were able to create a trust using their natural resources to fund this initiative. But the way that they're doing it is what's important. Not only are they expanding access, but they're addressing these other areas of shortage at the same time, such as low worker pay, which drives turnover. For example, let's look closer at San Francisco, which has decades of progress towards an abundant system. What started out as merely adding spaces, a lot like what California has been doing, has transformed into a much more rigorous strategy of really thinking about per child funding, different types of ways of dispersing funds, including more contractual based funding that providers can count on, and then iterating and growing towards a system that can encompass more and more families. So it focuses on the quality of the system and not just the quantity. Even though, of course, abundance is about quantity. We have to have quality along the way, or you won't build something that can last. I think we can all agree that the system we have now isn't working for anyone. Certainly not working for the parents, and it's not working for the providers, and it's not even working for employers. So what we need to do is acknowledge that and do something new. Use this abundance discussion as a way to catalyze big changes. And by that, I mean, first and foremost, funding. Funding to reach this state of abundance. Parents can't afford it, and we're not going to get there by market forces. So let's acknowledge that and then proceed accordingly.